Medical professionals of Reddit, have you ever had a patient so lacking in common sense you wondered how they made it this far? If so, what is your story? From r/Ask Reddit. Part 2. Optometrist here. Patient booked in for an emergency appointment, with a raging red eye. Clearly very painful. Look under the microscope and the cornea is really not happy, wobbly reflexes. Haziness, the works. Me, what happened? Patient, it's my niece's wedding this Saturday, and I wanted to tint my eyelashes to match my hair and the color scheme of the wedding light blue. So I used the same dye for both to match the color. Me, does that hair dye contain ammonia, by any chance? Patient, I think so. Do you think my eye will be better by Saturday? Will it match the color scheme? Me, unless you can convince then to change the color scheme to red. No. Edited because I read a comment about healing crystals and now I remember a story from a colleague. Patient attends a routine test complaining of gradually reduced vision, which turns out to be due to cataract. My colleague offers referral for surgery. No need, exclaims the patient. I know what I need for this. I have lapis lazuli at home. 6 weeks later came back for the referral. Second edit for remembering the first story that made me question my sanity. Elderly patient attends with concerned family members because the patient ran over a pop-up tent in the side of the road that the telephone engineers use to protect themselves from the rain. Luckily no one was hurt as the worker was on lunch. Worried as to how the elderly driver missed seeing a large red and white tent in the middle of the day, it was then that the elderly relative admitted to having spent the last 3 years driving from memory. Plenty, although the one that always sticks in my mind is a patient I met during my early years on a palliative care ward suffering from terminal cancer. She was only in her early 30s, and the only reason she had gotten so far gone was that she had relied on the healing power of crystals rather than, chemotherapy. EMS here. Had a diabetic in his 30 to 40s who refused to take insulin since 2012. It was 2020 at the time. When I took his blood sugar is only read as high, meaning it was over 700 for glucometer to not read it. Upon seeing this, he asked me if that was high and then went, "Is this cause of all the ice I ate?" Played Facebook Messenger video with his girlfriend the entire time. Met him later on the parking lot after he got discharged. And it took this man less than 50 paces from the ER door to rip off his bandage covering his fore and play with the fore wound until it started bleeding. All over the place again. Knocked on our ambulance door and asked for a band-aid to fix it. We had to walk him back into the ER and bandaged his entire arm with gauze so that, hopefully, by the time he got it off it would have clotted enough for him to not end up exsanguinating himself. Not a personal experience, but one from a colleague of mine. I only saw the pics. So this 60-something-year-old suffers from an acute complication and gets a pacemaker to solve the problem. Everything goes normally and as planned, he recovers, every care and meds that he needs to take are prescribed. Explained, and medical appointments with a cardiologist/arrhythmologist are scheduled so that he may get the follow-up he needs. The man then proceeds to never show up to any appointment and never answer any calls from the hospital to know of him and reschedule. This went on for around 3 years. Until he shows up without former warning and asks to talk with the doctor that did the procedure to put his pacemaker. People are weirded out, but seeing that on that day the doctor was present and this patient was in clear distress, they talk to him and manage a couple of minutes to have the doctor check on him. Inside the appointment room, the doctor takes notice that this man is wearing a bra inside his shirt. The man explains he has been wearing his daughter's bra for 3 months after his problem got worse. The shirt is asked to be taken off and there he stands. The shirtless man wearing his daughter's bra, showing off the pacemaker. That should have been kept inside his body, dangling outside of it. Being held by the left bra cup, with a big infected open wound above it with the pacemaker lead still inserted onto his veins and connected to his heart. Nobody has any idea how the man let that situation come to be or how he didn't die of sepsis or any other health problem that may appear for that matter. TLDR, man gets a pacemaker. Doesn't show up to appointments. 3 years later comes to the hospital looking for help, wearing his daughter's bra for 3 months. To serve as a holder for the pacemaker that got out of his body from his infected open wound. I don't know if cleaner in a hospital counts, but this one time I got to work early on a Saturday morning and we immediately received a request for help from the ER and got sent over by my boss. When I got there, the first thing I heard was yelling from this guy behind one of the curtains. He was shouting at the nurses, "Don't touch my penis," and I didn't use any drugs. Then I smelled iron in the air and then I found out there was blood all over the hallway. Handprints in blood against the wall. Almost the entire floor was covered in blood with actual puddles in some places. What happened? The guy pulled out his catheter causing arterial bleeding and decided to run away from the nurses who were trying to help him. It seems like he lived through that. I never seen that much blood before that day nor after. Former practicing surgeon. Male came in with a small bowling pin up his backside, for the 3rd time. I overheard a conversation between a nurse and a doctor and a patient in the ER. They were trying to figure out if he was very stupid or has a head injury. It was both hilarious and sad. He kept telling them that he was there for a hurt leg. He couldn't explain why his leg was hurt, how it was hurt, how he got there. Nearly anything. I heard them taking in a hallway to each other. The nurse was convinced he hit his head. The doctor said no, he is just an asterisk diet. Turns out the doctor was right. They go a hold of the guy's wife. She basically told them in the hallway he is always this dumb and if she leaves him he would get lost in his own house and starve. Edit, it sounded like his leg was visibly injured or swollen. But when asked what happened or how does it feel, he gave nonsensical asterisk diet answers. Not like slurring but in a regular asterisk diet voice. It feels hurt. I was talking to Jimmy and we were doing our usual work and my leg hurt. Doc, did something happen? What is the work? Something always happens, you know how it goes. I just want my leg fixed. This was one of the funniest yet cutest one, was a student doing a shift in andrology/reproductive health. Doc, so you're trying to have kids but not managing to. So do you have any other kid? Patient, asterisk yes doc, I have one. Asterisk doc, asterisk okay, so we need to do this and that, asterisk patient, okay great. Then he proceeds to visit him and stuff, after which he goes away. After a couple secs he knocked the door again saying, "Hello doc. My wife told me that it would be relevant to you that the son I have is adopted. But that's make no difference to me, I always considered my own son." A woman called 911 because a cougar attacked her cat. She thought we could help the, very clearly dead, cat. A man called 911 because a cow bit him. He didn't want EMS or an assessment or anything. A man called 911 for an itchy butthole. Took him to the ED because we have to. The doctor asked the patient if he had put the cream on his butthole that he gave him last time. Patient said no. Next time patient called us for his itchy butthole, I offered to put the cream on his butthole for him. He declined. Took him back to the ED. Not me, but sibling. I don't think he'd mind me sharing the story just on the off chance it prevents someone else from making this mistake. Lots of surgeons have a similar story, but thankfully this one doesn't end in someone's death. Parents claim their child hasn't eaten anything before surgery, as they were carefully directed. Turns out they thought the surgical team was just being cruel to their child, and when she said she was hungry that morning, they deterred on their way to the surgical center and got her a full southern breakfast. She d*mn near died aspi rating biscuits and gravy. I've rarely seen my brother so angry, and disgusted, Somehow biscuits and gravy looks even more nauseating the second time around, and he was just recounting what had happened. I have no doubt he tore a strip off the parents once their 5-year-old was stabilized. And they probably still felt justified and angry at the surgeon for telling them what they could and could not feed their child right before anesthesia. ETA the parents did in fact feel justified and hard done by, although a fake they didn't express anger at my brother, knowing him. They didn't get a word in edgewise. Definitely no acknowledgement or realization that they could easily have killed their own child or that they'd made a bad decision. I remember they were annoyed by her whining for food. I'm a nurse. This isn't about a patient rather than my dad. He is convinced that insulin is what is giving people diabetes and doctors are prescribing it just to make money. After 30 minuets of telling him why that's wrong, he said not to be so liberal, and I didn't understand because I'm not a doctor. Woman comes in with no prenatal care to labor and delivery in labor. OBGYN resident taking a history, do you have any allergies? Patient, yes, I'm allergic to water. Resident, okay, what kind of reaction happens when you drink water? Patient, oh, it makes me pee. Yeah lady, that's a feature not a bug. I work in clinical research at a hospital. Basically, for patients who have cancer and don't have other standard of care options. Clinical trials, experimental treatment, are a viable option for many. Some people have a negative view of research, but it's highly regulated and not as scary as it sounds. We go through the consent form with this patient, who has a history of drug abuse. We don't know everything about this new medication, but one thing we do know is that using cocaine while taking this drug will make your heart explode, in layman's terms. This patient promises they're off the sauce and that they totally won't do cocaine while they're on the trial. 2 weeks later they relapse and, well, you can figure out the rest of the story. Working midnight in the ER. Family brings in a 4-year-old at 2 am-ish. I ask them what is wrong. Them, ask him, the 4-year-old. He said he needed to see a doctor. Me, did he say anything was wrong? Them, no. He said he needed to see a doctor, so brought him. A quick back and forth that firmly establishes that they actually showed up in the ER at 2 a.m. Purely because the 4-year-old said he needed to see a doctor and they don't know why. Me to child, why do you need to see a doctor? Kid, the doctor has suckers. Me, flushed face. To be clear, it is the parents who lack sense and not the kid. My wife is an anesthesiologist. When training junior doctors, one of the things she has to reinforce over and over again is that you never leave drugs unattended in an unsecured area in a hospital. Even for a moment, because some people see drugs and think fun and take them even if they don't know what they are and they just raided a trolley or picked up a syringe off a bedside table. And then, because the drugs used for anesthetics in hospitals are quite serious, those people quite likely end up dead or vegetables. And this has actually happened more than once in hospitals she has worked in. When I was in the hospital as a patient, there was this one guy in ER who really wanted to step outside to smoke. The nurses pretty much belted him on the table and yelled at him that he had complete kidney failure and they need to treat him immediately or he will die in the next 20 minutes. To their dismay, he didn't listen and tried to vehemently free himself and go outside and smoke. He was in his 30s, it is a mystery to me how this guy survived that long. Please like, subscribe, and leave a comment if you enjoyed. Keep the thread going in the comments section down below.